Well, welcome back, everyone, to Soda City Live. For Be Well Wednesday, Lexington Medical Center wants to hear from you, the patient. They're doing that through a community health needs assessment survey. A what, you ask? Well, Thomas Tafel is the community outreach manager at Lexington Medical Center, and he's going to explain that community health needs assessment. Explain to our viewers, you explained it to me during the break beautifully. Sure. This is something that's been in place. It was implemented under the Affordable Care Act, where you as a hospital organization need to kind of check in with the patients, the community, and see what they think the needs are, and then you try to implement change and meet them where they are. So this has to be done every 3 years, and it's time to do it again. And explain how you're doing it in partnership with other groups. Absolutely.
So like you said, every 3 years we conduct a community health needs assessment. What's a little different this year is we've done it independently the last few times, but we are partnering with MUSC, DHEC, and the South Carolina Hospital Association to implement a more comprehensive survey to ensure that we hear from all of our patients in our service area for both MUSC and Lexington Medical Center. We're really excited about that opportunity, and what that does is once we identify and assess the needs we get from this, then it drives our community health efforts to fill the gaps for those unmet needs in our community.
And we'll talk about some of those ways that they've been met in the past, but if somebody wants to take this survey, and they don't necessarily have to have been a patient, or currently, if it's just somebody watching right now and says, hey, you know, I really see, you know, XYZ should be addressed, they're welcome to fill this out. What are some of the questions that they would see on the survey?
Sure, so typically when you look at the community health needs assessment, you're going to have a few areas that identify needs. It's a community health question. Do you feel safe in your community? What do you identify are the biggest health needs in your community? There'll be an individualized section that kind of focuses on your personal needs. If you have children, you can answer a few questions about that. And then some general demographic data. It is anonymous, but we do like to see where the zip codes are, or just general demographic data to ensure that we get that.
And so once somebody fills that out, they want to know that something's actually being done about it. It's more than, hey, you know, I'm just telling you, but I want to know I'm heard and there's action taken on it. So what has been implemented over the past by the surveys that have been done?
Sure, absolutely. And you know, I find this to be one of the most effective and impactful things that we as an organization do in the community. We, in conjunction with Harvest Hope, we set up a diabetic food pantry in 6 locations in Lexington County. Diabetes is consistently identified as a big need in our area, so we set that up. Also, for our last needs assessment, we received a Duke Endowment grant for $1 million to address mental health needs in Lexington County. And that's in partnership with Lexington County EMS, Lexington County Community Mental Health, and our emergency department to ensure, and Serve and Connect, to ensure that we address those needs appropriately. So
let's talk a little bit about the Harvest Hope one, because I had actually covered that story, and I love that you bring that up, and that did show the positive change, because a lot of diabetic patients who need that supplemented food source were saying, okay, they tell me not to eat this, that I need to eat this, but they were going, and there were a lot of high salt, high sodium canned foods that weren't the best and the freshest, and so by you kind of working with them, you guys were able to create these boxes that do provide healthier options for them.
Absolutely, and actually last year they just reported to us they served over 17,000 meals through that program, and we have consistently partnered and funded that program over the past 3 to 4 years to ensure that it continues on, and it's a great way to limit some of those foods that may impact or cause diabetes.
But again, you kind of found out about, hey, the public's asking for this through the survey. So if someone watching right now would like to do that survey, how can they go about that?
So it's currently active. They can go to lexmed.com, and there's a search bar in the corner, and type in Community Health Needs Assessment. It'll take about 5 to 10 minutes to fill out. We'll also be shooting it out on our social media. You can find it on Facebook at Lexington Medical Center is on our page, and we'll continue to shoot that out throughout the rest of the summer and the fall to ensure we get enough responses.
So again, it can be anonymous. You do ask for maybe a zip code just to know the region, and it takes about 5 to 10 minutes. Okay.
Absolutely.
Doesn't cost anything?
Completely free, anonymous. We just want to hear from our community that we serve.
Wonderful. Okay, well done. Thank you, Thomas.
Yes, absolutely.
So and I love that you wore your name tag just in case I forgot you.
Of course.
Let's see, who am I interviewing? No. Thomas, thank you so much from Lexington Medical Center. More Soda City Live right after this.
Well Wednesday is sponsored by